Life is funny because there are definitely laws in the universe, in my view. If you have a get over here, then something's got to give over there, right? In our lives, I believe we come to a fork in the road, and there's a right fork and a left fork. And the right fork might be all like sunny and rainbows and unicorns, and the left fork might be like fire and brimstone and just utter devastation. And sometimes that's the road that you choose to go down, but at the end of that road, there are beautiful things.
Are you sick and tired of the high costs and inefficiency plaguing our US healthcare system? Do you feel like you're navigating a maze when dealing with insurance companies, only to end up paying a fortune for basic medical services? Then this Broken Healthcare podcast is for you. So get ready to take control of your healthcare. Here's your host, Ray Kober.
And we're live, ladies and gentlemen. Welcome to Broken Healthcare. My name is Ray Kober. I am your host, and I'm delighted to have with us today Sasha Gribov of Milu Health. Welcome, Sasha.
Thanks, Ray. It's awesome to be on. Great to see
Right
you.
on. So I think our paths crossed at a conference. I think it might have been Rosetta Fest. And we got to talking a little bit with the breaks. You always overloaded with just like data dump at those things. And we chatted for a few minutes. And I thought it'd be interesting to have you on because you're a startup company that's involved in data and the merging of technology. And tell us a little bit about what you do.
Yeah, sure. So I'm the co-founder of a company called Milu Health, and we do one really basic thing, but it hasn't been done before. So we're super excited about it. We connect to electronic health records for members, and we use that data with a whole bunch of AI in the back end to identify any which way that we could help someone save money, help someone get better care, help someone use their benefits. And then we text them about it. And that's it. So from a member perspective, it takes like 30 seconds to sign up. And then you get text messages from nurses on our team whenever there's something that matters to you. But on the back end, we're doing a ton of stuff, running AI agents on top of electronic health record data, claims data, et cetera, to figure out when is there actually something that matters for a member. So we try to keep it really easy so that an employee that's a production worker or an auto worker or a truck driver or a desk worker, they can all sign up and very easily use it. We got to cross that chasm of people not understanding stuff in healthcare and not using it. But we also have to find something that's relevant for a human being at the time that they need it. So that's
Yeah.
our goal in life.
So, I mean, it sounds to me like the goal is to make it easy, right? Because we're in a day and age where healthcare is more confusing than it's ever been. Most folks don't understand the difference between a copay and a deductible. And honestly, like I didn't until I was in the business and had to understand what it was. And it just seems to get more and more confusing as time goes on. And so I guess it sounds, in theory, like your solution can be very impactful, but I think the hurdle or the chasm, if you will, is how do you simplify it so that is an alert going off on an employee's phone? Is it that simple? And give us like a real world example of when Milu Health might intervene.
Yeah, that's exactly it. It's funny when you dig into this stuff, as you have for years, and probably many who are watching this, you see there are so many places in our healthcare system where things break, but they're not unsolvable problems, right? Like if you have a human at that time who knows the system, you can solve pretty much any one of those problems, with the exception of plan design issues and carriers and networks, et cetera. But like your average day-to-day stuff can be solved. The problem is that never happens. Your employee is months into a claim by the time anything actually moves, and maybe the gears start turning to try to do something about it. So that's what we try to set out to solve. The reason we can do it So in the past, people have tried to do this kind of stuff, right? But by the time a claim comes through, the surgery has happened, the prior auth has been set, and the doctor has been chosen.
Yeah, that's a huge problem, right? People are managing their healthcare expense looking in the rearview mirror. So they're managing it after the opportunity is gone to address the cost issue and the quality issue. And so that's interesting. So where do you come in exactly?
So here, you need a crystal ball, right? You need some way to get ahead. You need a crystal ball, and you need, I don't know, what's the opposite of a rear view mirror? The windshield, the forward facing mirror. You need both of those. You need to predict the stuff that's going to happen in the future. And you also need to see the stuff that's happening now in real time. Well, magically, as over the past decade and a half, electronic health records have permeated the system, that data is actually there. There's nothing out there that says, hey, I have a stomach issue, I haven't gone to see anyone yet, right? It's inside my body, it's inside my head, I'm talking to my wife about it. You can't do anything there. But by the time I go and talk to my primary care physician about it, start looking for a specialist, send a message, make a call, data's there, it's in medical records. But nobody's had access to it before. And so the platform that we've built plugs in with a member's authorization and can see that as it's just starting to happen. And it's the notes from the doctor's visit, it's the lab values, it's the pathology reports, the radiology reports, it's all that stuff, and it's all there. So you can start to see, hey, Ray just went to his PCP and complained of this issue, and now he's gearing up to 2 different specialists. Like, we see an issue starting to develop. So to your question before of what are some concrete examples, there's a ton. So number one is what we were just talking about. There's an issue that's starting to develop and you need a specialist referral, and we can go in and we can help. And of course, we customize that to the plan. So if you have a direct network, if you have a center of excellence specialty service, if you have a local surgery center that you contract with, we can build all those things in to notify. But it goes beyond that, right? Because just needing a specialist is like one small sliver of the bad and complicated stuff that happens in healthcare. So we go beyond that. We'll say, hey, if we see that someone just was hospitalized and they're a part of a blue collar workforce, are they eligible for financial aid? And we'll reach out to them about that. In our world, it doesn't save the plan a ton of money, but it can be life-changing for the employee. Or is the employee a diabetic who's not managing their A1C, but they've got a great diabetes point solution? Let's make sure that every one of them knows about that, not the 10% who are utilizing it today because they went to the open enrollment meeting. So those are a few of the examples.
Yeah, interesting. And so what's your background, Sasha? Like, how did you come to this? Are you a Silicon Valley guy? Are you an MIT grad? Like, what's your background? And how did you, I don't want to use the word stumble and put words in your mouth, but how did Milu Health come about?
Sure. I'm a Michigan grad. I've been in the tech startup world for my whole career, for the better part of the last decade. I've spent a bunch of time investing in startups, working at larger technology companies. And then I spent the last 7 years helping to build a company. I'm based in Chicago, helping to build a company called Tempus that's based in Chicago that does genomic sequencing for cancer patients. And I met my co-founder, Gotham, over there. And the two of us just became obsessed with the fact.
Did you say your co-founder's name is Gotham?
Yeah,
That's
it's pretty cool, right?
Name.
It's a badass name. And it's spelled Gautam, so it's hard to pronounce, but it just says it's like Batman. It's not that hard. And he was born and raised in New York City, so he's got the whole Batman Gotham thing going.
Can't be as cool as his name, but that's a cool name.
Yeah. But so we were both in this healthcare and AI world at the intersection of it, seeing that, hey, it's now possible to get access to health records when members are fine with it. And you can do something with that. And now there's AI that can sit on top of that stuff in a secure and compliant way and be used for something that's super useful. And then we got obsessed with the fact that costs are completely out of whack, like you've been talking about and preaching for a while. And that employers are getting the short end of the stick, especially smaller self-funded employers. So we said, let's go and try to do something about it. That's how Milu came about.
Interesting. And so how's it going out there? It's not easy to bootstrap a startup. I've done it before. And it's one of those things where I always say life is funny because there are definitely laws in the universe, in my view. And there's always, like, if you have a get over here, then something's got to give over there, right? And in our lives, I believe we come to a fork in the road, and there's a right fork and a left fork. And the right fork might be all like sunny and rainbows and unicorns, and the left fork might be like fire and brimstone and just utter devastation. And sometimes that's the road that you choose to go down, but at the end of that road, there are beautiful things. And so I'm always curious about folks like you that are like-minded entrepreneurs and what your thought process is, because in some respects, yeah, there's a huge opportunity, but in other respects, it's a hell of a lot easier going to work for a company as someone that may be a rising star or a key employee. And so it's not as cut and dry and black and white as many people might think. So I'm just curious as to what your thought process was there.
Yeah, it's funny on that analogy between the two roads. Starting a company is, to me, it's driving on both of those roads. And it's not like both those roads at the same time. It's just every day you jump between. One day you are king and queen of the world, and the next day everything you do is a train wreck. But that makes it fun. When you're on the good path, you got to remember that you've made it this far and you got to go like way out there. And then when you're on the bad path, you got to remember that you're having an impact and there's a reason this stuff hasn't been built before. So
right.
It's a funny journey. For us, we saw the decades of failures in this space of failed price transparency companies and the 175th employee benefit that can't get off the ground, that nobody wants to hear about, nobody uses. And that employers are busy and trying to run a business and don't have time for healthcare. They're trying to sell widgets or cars or whatever. So we went into this thing saying, this is going to be really, really hard. We're not going to run this like a tech startup where you raise a bunch of money and you blow it, you hire a crazy team and then no one uses it and yada, and you promise a bunch of stuff and you don't deliver. We said,
no parties on yachts with hookers and cocaine? No.
The party is a few of us plugging a leaky canoe and like building it little by little with a turkey sandwich, which by the way is great. Just rowing every day, just rowing a little bit further. So we were lucky. We came into it knowing that. And we said, okay, if that's the world you're in, you got to build it brick by brick, the old fashioned way. And you got to raise enough money to be able to do that. So on day one of the company, we raised a great funding round from awesome investors. And we said, we're just going to make that work. And we're not going to have to do wacky things that are unnatural that won't let us build. We'll raise enough money to be able to build this company the right way. So we did that, and that's let us keep going. And now basically every year we're tripling or quadrupling, and that's the place we want to be.
That's phenomenal growth. That's great. Organic grassroots growth is very impressive, and it's not easy to do. This episode of Broken Healthcare Podcast is brought to you by Benefixa Healthcare Consultants. Visit benefixa.com to learn what's possible. Reduce the cost of healthcare for your organization, deliver better outcomes for your people, and yes, design health plans that give your people a path to $0 out-of-pocket costs for healthcare. Visit benefixa.com today. Who's your ideal market? You're primarily in the private employer space, I would imagine. What's like an ideal demographic or candidate, if there is such a thing, for you guys?
Today, we work with a lot of small to mid-sized self-funded groups, so in the hundreds or thousands of employees. That's not to say that we can't work with groups in the tens of thousands, the hundreds of thousands, but today we're really focused on the you run and traditionally more blue-collar employers, because we find that, honestly, they need more help with healthcare costs. We've got groups that are also desk workers, white collar, traditionally richer healthcare plans. Like we can have an impact there as well, absolutely. But the crazy impact is when you have workforces in lower margin businesses that, by the way, are starting to have more and more health plans with incentives in place and programs in place that you need to guide people towards. Like what we see is we can work with the traditional Blue Cross, United, et cetera, plans and help there. But there's honestly less impact in a plan like that, right? If we don't have a center of excellence to guide folks to, or an incentive program for higher quality physicians, or whatever it might be, there's just less opportunities to route people. You can still do the basics. But a lot of our groups are, let's call it 700 employees across a few manufacturing plants in the Midwest, 1,000 employees, and they've got a point solution for a specific chronic condition that they've identified in the past and have tried to solve for. And they have a great pharmacy tool, and they've got a few direct contracts, and they need us to come in and say, listen, we're going to engage your employees. We're going to help them. It's all a text message with the nurse, but we're actually going to start using data to route people to the right stuff and to dramatically increase utilization and engagement of this stuff.
Yeah. And so how long have you been doing this?
We got started about 2.5 years ago.
And how's it going? So I always say there's two things that you have to pay attention to if you're managing healthcare as an expense, as a budget. And one is just that, it's the monetary side of it. What is the impact to the bottom line? What's the cost to the organization? How generous can we be with our people? What's the ultimate cost to the employees and to the member? And that's one bit. The other side of it is, what is the experience like? Are we elevating the experience for the employee, or are we diminishing it? Because there's very few opportunities, I can't think of any, where you want to have the employee experience go down, because there are too many tentacles attached to that and far-reaching implications that you can't measure. How does it impact recruiting, retention, et cetera, and on and on and on and on and on. Where do you see yourself fitting? Are you straddling both of those pillars, or are you more leaning one way more than the other? And the ultimate question, Sasha, is how do you demonstrate ROI to a CFO that might be listening, that might be tapping in here and saying, I do want to get a handle on this. There are a million shiny objects out there. What's compelling about Milu Health, and why should I consider it?
We straddle both of those, because what we find in our world is it's very hard to impact cost if you don't engage an employee. Let me take that back. There's things that you can do to impact cost on the plan level that don't require the employee, but you don't need us to do that. You need a great advisor on your side who's going to help you figure out the right plan and pull the right levers. And by the way, that's where you save the most money, right? You can save 30%, 20% more, whatever it might be, by making smart changes to your plan. You got to make those decisions on your own with your advisor. And then once you have your plan, you're left with, okay, great. Now, how do I actively manage this thing? I can sit back, do nothing, let it run. Oh man, we had a bad month this month. Okay. Or you could pull in a solution that's going to go in and basically go member by member, claim by claim, health record by health record, and identify ways to help. And that's us. And you could also look for other ways to do that too. But none of that matters if the employee is not engaged, right? So we go out of our way to do stuff that won't save money for the plan because it'll engage an employee. For example, we'll go help folks with financial aid. We'll help folks look at bills that are incorrect. And we do that at our own cost. We don't charge like a surcharge or a percent of savings on a bill to help someone with it. We find the folks who have a large bill from a hospital, they're going to be your folks who are typically your higher cost claimants now or in the future. And if we're able to earn their trust, and we have to earn it, but if we're able to earn their trust and help them with a large bill, whether there is something wrong on it or not, they're going to know about us. And it's an opportunity for our nurses to be talking to them and explaining, hey, by the way, just so you know, you could save on MRIs, you could save on lab tests. You have these amazing solutions in your plan. We can help you find a doctor when you need it. We're a text message away, et cetera. So we start with the employee experience because that drives everything. And then we impact cost.
Now, are you putting eyeballs on this, or is that part of your IP? Are you deploying AI tools, or what is flagging a nurse? What's hopping up on your side of the table, not employee facing, saying, hey, Sasha, we got to take a look at this guy because his LDL blood work just came back. His LDL is off the charts.
Yeah, that is where we spend all of our engineering and data science time. It's funny, when we started the company, we thought, oh, great, we're a tech company. Like, we're going to build all these great tech tools and solve healthcare, yada, yada, yada. I'm sure you've heard that story many a time. And we realized really quickly that the answer is not deploying another app for employees and having something pretty and fancy that like 2.5% of people are going to ever use. And that 2.5% might be a stretch. So we very quickly went away from building out like consumer tech. Like, we're not trying to create a TikTok app or an Instagram app or any of that. And we just boiled it down to the member needs a text message. That's the best way to get in touch with them. And that text message can't look like spam. So we do smart things like send a video from our nurse and have them save our contact card and send them a text message when they register. So we're on the same chain and they see that we're legit. But at that
And so 20% of members are spending 80% of claims dollars, right?
Yep.
And is your tech savvy enough? Are you bothering the 23-year-old that never goes to the doctor and rarely engages their healthcare system? How often are you contacting them?
Very little. Like, we don't do blanket messaging that's useless. Sure, if someone needs us to also handle their basic communications, we can, but there's systems for that. You don't need us for that. And the 23-year-old doesn't need us. Like, we'd like for them to connect their health record. We want to be able to see what's going on. But by the numbers, they're not the issue and they need the least support. Where we help is the 62-year-old that has a few chronic conditions, by the way, has a spouse that's going through something, and we're able to follow along and help them. And we focus on how do we engage those folks? How do we help those folks? That's the big piece.
And can you, at this point, do some modeling and show a CFO how they would experience ROI on a solution like this? Or is it not about ROI? Is it really just more about managing healthcare in a better way for the members' benefit? And I guess the ROI would be in the form of a lower renewal because you're getting ahead of it, or is there something else?
No, there's got to be an ROI. So we're laser focused on ROI. Today, we see about a 4 to 5x ROI on our cost. That's higher than I think is realistic at scale. I expect us to come into the like 2x to 3x range at large scale, but there has to be an ROI, right? Like, why would you'd implement a solution to help your people and to do long-term stuff, but everybody promises that. And so for us in ROI, we look at what are the direct things? Every is tracked in our system. To your point before, what's the technology? What's the AI? The front end for the member is a text message. The back end is dozens and in the future hundreds of AI agents that are looking at data, matching it up against the plan and saying, hey, it's relevant for Ray and we need to reach out to him. And then our team of nurses looks at that and reaches out. So there's no AI that's going and sending anything to a member ever. The AI is identifying stuff and then it props it up for our nurses and our nurses reach out. And that's very scalable because that's kind of the promise of AI. I think the really impactful companies that are going to be built in AI are going to be companies that sit on top of businesses that have humans today and make those humans way better. Whether it's a doctor in an office using an automated note-taking tool, whether it's you and I on a Zoom call and using an AI recorder that tells us our follow-ups, whatever it might be, it's humans augmented by this stuff. So that's what we've tried to do. And then because we do that, we're able to say, hey, what are all the things that we've done in the past month? And then 3 months down the line, what happened? And is there a cost savings there? And some of those are direct cost savings. Hey, someone needed a surgery and we helped them find a local surgery center. And so the cost of the plan was $25K instead of $55K. And others are going to be savings just to the member, but not to the plan if we help someone with financial aid, for example. And then the last piece is there's always going to be indirect savings. We recommended a great doctor for someone. And there's a bazillion studies out there that say if you go to a great doctor, your cost is going to be 30, 40, 50%, whatever it might be lower. And so you have to look at those things as well.
Yeah, it's intuitive in healthcare, but the cost and quality are inversely proportionate. And so typically the highest quality is the lowest cost. Are your nurses interfacing at all with TPAs, plan administrators, or is it strictly employee facing?
No, we do both. We have some groups where we do less with TPAs. We have other groups where we do more. But at the end of the day, if you're solving member issues, there's always going to be something that comes up where, hey, my doctor asked me to pay out of pocket and it's not being counted towards my deductible, like what's going on? And if we're talking to a member about that, then we of course need to go and take that to the TPA. We also, by the way, have other models where an employer has their own nurse or their own DPC or their own care navigation team, or the TPA is a care navigation team. And that's great. We're happy to sit on the back end and just be the technology layer that empowers those people or partners with those people. Like, we have no need to make things more complicated. Like, we don't need to be navigators. We're not trying to be navigators. We're trying to proactively identify things. And whatever's the right way to get that information to the member, we're happy to play in that sandbox.
Cool. And so do you have like a one size fits all price model, or is it based on the size of the group, or how do you price this thing?
We have two models. One standard PPM, $6. The other, if folks don't want to do PPM, is we'll go and we'll do usage-based pricing. And it's of course going to be more expensive, but only billed when someone uses it.
Got it. So the per employee per month fee is for everyone that's enrolled in the health plan, and your system is just, how are you hooking in? Do you have this data based on publicly available information based on people's social security numbers, or how do you tap the data set that you referred to?
We get authorization from the member, and then we connect directly to nationwide networks, providers, and electronic health records.
Interesting.
Yeah.
Interesting.
But it's a critical thing, because that data's there and it's not being used today, and it can be. You can do great stuff with claims data, and I think we've only tapped like a small percentage of what we could do, both predictively and educationally, off of claims, telling someone that, hey, you're spending a lot, or some other options for you. Like, there's a lot we could do. But the minute that you can bring in data that's real time, it completely changes the game.
Yeah, no doubt. That's exciting stuff. So where do you see things going? What do you think the market opportunity is for you guys? And what do you think about the future of healthcare in America? We've got a lot of changes that just went down here in DC, and it looks like, I don't know if we're in for a rough ride or not. I'm very optimistic about the future, but time will tell. I don't think anyone could call it at this point. How do you feel?
Yeah, I have no idea what's going to happen. I know what's not going to happen. Like, the system's not going to magically change, regardless of what's going on in DC, what's going on in state governments. Like, there are incremental steps that can and should be taken. Like, on a state level, there's all kinds of regulations that we should be passing to let doctors open more of their own hospitals and surgery centers, to let doctors have more control over the system, to get, frankly, if I was healthcare czar of this country, I would dramatically chop down on medical malpractice lawsuits. We don't need large hospital systems spending millions of dollars on lawyers unnecessarily. We don't need doctors feeling like everything they do, they're going to get sued for. That's one thing that I think we could easily do to make the system run a little bit, and not like politically weird or hard. I think regardless of what happens, our system is still going to be in this world where costs just keep going up. Like, we're not going to go to a European like one payer. It's not going to happen. And so what does that mean? Employers are still going to be left on the hook for this stuff. And I do think everything that we're seeing with lawsuits and fiduciary responsibility, like, I do think that stuff's going to keep escalating, and there's going to be more pressure on employers to be actively engaged with these health plans, and not just put a few solutions in place and say, okay, great, we'll see where it lands. And then I think the other thing is, there's a lot to this movement of Health Rosetta and Mark Cuban and grassroots folks out there saying there are better solutions for employers, transparent PBMs. Like, it's starting to happen, and it's going to take more and more time, but the needle will start moving. And so for us, I'm insanely excited, because you need technology to power this stuff. And now we have the data, so let's go and let's use it.
Yeah, really exciting stuff.
In DC, separately, unrelated to us, like, I hope we make our food less shitty. And
well, I think that's coming. I think we're going to see a new food pyramid relatively soon into the new administration. And that's some of the stuff that I'm very excited about. It's going to sound like I'm a hard redliner, but it's not a red-blue issue. Really, it's not. It's just common sense that our food supply is poisoning us. We have over 10,000 approved ingredients, by the FDA here in the U.S., and there are less than 400 approved chemicals and additives in the European food system. And they live 5 years longer than us, and they have a fraction of the comorbidities that we deal with here. And so we don't need a double-blind study for this shit. Like, it's pretty commonsensical. And so I'm encouraged by the lineup and the team that's out there. I know that there are plenty of people that don't share my sentiment, and I think there's way too much divisiveness and hard red liners, hard blue liners. Man, let's all just get along, and let's get back to common sense. If we improve our food supply, if we can figure out a way to make it economically viable, to improve the school lunch program for our kids, I don't care what your political affiliation is. That's a fucking good thing. It's like, come on, man.
I totally agree. Like, there's stuff that's political, and there's stuff that like everybody can agree on and makes complete sense. And less chemicals in our food is a big one. And knowing what's in our food, and like being able to go to the grocery store and say, okay, great, I want to spend more on organic milk because I want to like feel good that my kids are getting that and it's going to not mess them up. And then finding out that maybe the organic shit actually has more chemicals. Like, I've seen studies on that. So I agree. Now, I don't know how you do it. It's a tall order. It's one thing to say, great, we're going to say, what are the chemicals that we ban or that we approve? Let's copy paste from the countries that are best in the world at it. You can do that like that. And I think we should.
Yeah.
But then what goes before that, right? What are the pesticides that get put on the crops? And like, we feed the world, we feed our country, and we feed the world. Mm-hmm. And should we ban some of that stuff? Probably. But also, like, we've created this agricultural miracle over the past century in our country where we can produce so much. How do you not reverse that? And
yeah, I don't think it's an uncomplicated problem, but I don't think it's an insurmountable problem either. I think we could figure this stuff out. And I just think that it makes perfectly logical sense that if the stuff that we're spraying our crops with kills the bugs that are landing on the crops, that are destroying the crops, it's going to have a similar effect on our gut biome. And so what is the answer to feeding the world if you take that away? I'm not an expert, and I don't know what the impact of that would be. But I think you got to look at it and say, listen, I traveled to Italy this past year, I have pasta over there. You don't feel the same effect after eating a bowl of pasta in Italy and eating a bowl of pasta here, right? It's a different process. It's not enriched with folic acid. It's pure. And so I think we could do that. Again, I think it boils down, what the real question is, what are the economics of it? And what does that look like in terms of the food supply? And it's a valid question. But it would just seem to me that if Europe is doing the job that they're doing, they're living longer than we are, and they're doing it with 400 additives and chemicals, as you said, we could just take a page from their book, and I don't think that would be too hard. So anyway, we could go on for days about that stuff. But I am encouraged by some of the leaders that are being appointed, or at least being nominated. Hopefully they will survive the appointment process, which is a whole other thing. But I know that there got to be a lot of people in our industry, in healthcare, the BUCAs, big pharma, they got to be shitting in their pants right about now, because things are about to change. And, you know, the only X factor or asterisk that I would put on this is never count those motherfuckers out, because they have so much money and they have so much power. But I hope it doesn't go their way, because if it goes their way, it's at the expense of the American people. And so stay tuned and we'll figure it out. But in the meantime, Sasha, how do folks get a hold of you? How do they find you if they want to connect?
Really easy. They can just reach out to me directly. They can find me on LinkedIn. They can go on our website, miluhealth.com. They can email me. I'm just Sasha@miluhealth.com. But we're super accessible. But
that's easy.
Yeah, it is. And we're here to make healthcare just a little bit easier. So
a little bit easier. Well, that's a very worthwhile cause and a great mission. And I commend you on that, and wish you the most success possible. Thank you for joining us today. We really appreciate you sharing your story and being here with us. So folks, if you want Sasha, he told you how to find him. Reach out on LinkedIn. He's super accessible. Is it miluhealth.com?
Mm-hmm.
miluhealth.com.
MILU.
Milu. Thank you for that clarification. And yeah, there you have it. So thank you for tuning in, folks. Until next time, peace and love always. Peace and love always. Take care.
So that's it for today's episode of Broken Healthcare. Head on over to iTunes or wherever you listen and subscribe to the show and join us on the next episode.